down. Yeah, I like this fit.
Well, thank you. Thank you so much. Thank you.
Is that me?
Are we supposed to have a paper for the peer review?
Yeah, you know what I forgot to know. So if you can download it online.
Where would I download it?
Let me see. Today's. Yeah.
I wanna lock the door.
So you don't get any interruptions.
Click the download, just click the download
Did
button.
yours show?
You gotta download it.
We for both.
What?
We for both.
Is that in today's module?
Group for me.
Yeah, today I
Team
sent it.
four, team two is group. So we're team six.
And then we'll just have to email them. So if our, whoever you're evaluating, you can get their email addresses today. It's in the. It's in the, announcement. presentation. Rio's gonna show the times up for you, it's gonna go decreasing, right? So you know how much time you have left, right? Cause everyone speaks between 4 and 5 minutes.
So next person speaks, they'll reset the time.
Yep. Yep. After the introduction is done. Okay, good. Ready when you are.
Perfect. Well, hello everyone. Thank you for having us. I don't know if you guys remember, a few weeks ago, we had a presenter come to talk to us about the graduate program. And during the presentation, she mentioned that a lot of us in this class are set to graduate next year with our data science degrees. So congratulations everyone. I know it's been a long road, and I know we're all excited to switch that expected graduation date on our resumes to a solid year. With that being said, by show of hands, who in this class is trying to leverage a degree to start their professional career? All right, perfect. And who here is trying to maybe leverage their new skills and degree to change career paths? Perfect, me too. With that being said, we're a team of data science majors, just like yourselves, who are trying to either start our careers, make a change. The team includes
Sonia, Fernand, Isabella, Vicky, Layla.
I'm David, and today we're going to be talking to you about the health insurance industry. Now, I know you guys, everybody here has dealt with health insurance on some level, but what you may not know is that it's a $1.9 trillion industry, so there's a lot of money coming in and out. And we've compiled data from government reports, from research articles, to kind of give you guys a comprehensive summary of the industry as a whole. And also we compiled data from United Healthcare to kind of give you context from more of an organizational perspective. So we're going to be talking about, in this presentation, we're going to be going over obviously opportunities for data analysts in the industry. We're going to be examining organizations in the industry, United Healthcare as an example, challenges facing the industry in 2025, current trends in the industry. But before we get into all of that, Vicky's gonna give us a history and purpose of health insurance in the US.
Okay, so who here knows what health insurance is? Who knows how it got started? No one. Okay, so health insurance was started back in 1929 before the 1920s. People typically pay out of pocket. They had prepaid plans. They also had sickness funds, but this really wasn't health insurance. It was more similar to like short-term or long-term disability leave. If you needed it, it was there for you, but it was the exact same income, no difference. And then the first actual health insurance plan was $6 a year for teachers in Texas, and it only covered 21 days of hospital stays. Eventually, in the 30s, it did grow. Like I said, Blue Cross Blue Shield is one of the first insurance companies, and then they started offering employer-based benefit plans, and of course, tax exemptions were there, so it enticed employers, and then it also attracted employees for the businesses. In the 60s, this is where you first get government involved in the health insurance industry, with the creation of Medicare plans for the elderly, Medicaid plans for those low income, and then HMOs started. They really weren't too strong just yet, but they kind of started to come out for those who couldn't, who weren't eligible for Medicaid, but who didn't qualify for Medicaid, but couldn't afford private health insurance. And then the 80s, you kind of see the expansion, the rising of costs, so more people started to go to managed care, control costs, things. However, this was reached with, there was some backlash from this, as these plans, HMO plans, managed care plans, you have a little bit less of an option of who you can see when you can see them. Finally, in the early 2000s, Clinton did try to reform some insurance plans, but it did fail. And this is when, in 1997, they had the creation of the CHIP program, the Children's Health Insurance Plan, to make sure that every child was had health insurance. And then there was also the introduction of the Medicare Part B for the elderly, so that their pharmacy needs were also taken care of, so medication and things like that, that they would need covered. Finally, in 2010 and in the present, we now have the Affordable Care Act. Some people may know this as Obamacare, kind of where it doesn't matter your income really is based on your income. So however much you make is how much your insurance plan is going to cost. And also, if you have pre-existing conditions, unlike before in the past where PPOs and HMOs can deny you, they can't do so under the Affordable Care Act. So in essence, health insurance is to protect individuals from high health care costs. It is combined of both public and private sector health insurance, and like I said, ultimately protecting you from the high costs that you would have to pay to providers. So there are some different types of plans. They're employee sponsored, ones that your employer pays for. There's private, where you can pay out of pocket yourself, or there's government plans. The government plans include Medicaid, Medicare, and the Marketplace. And then some of the private plans are HMO, PPO, and POS. And then you have a bunch of different options as far as insurances. You have Blue Cross Blue Shield available, Aetna, UHC, Humana, Cigna, whatever you want. And now I'm going to go ahead and hand it over to Layla to give you some more insight about jobs available for data analysts in United Healthcare.
Okay, hi guys. I'm going to be talking about 2 jobs in the United Healthcare field. So let me ask you a question. How many of you think that your doctor's offices or your health insurance companies really know how to use the data they collect on you? Okay, no?
I think so.
You think so? Okay, well, just to let you know that companies like United Health Group are sitting on mountains of data, and from everything from health records to insurance claims. And raw data by itself doesn't really help anyone. So this is where these 2 roles come in, a data scientist and a data engineer. Next slide. So a data scientist are the people who make sense of all of this information. They're the ones who turn the data into real insights. They build models using AI, and they turn raw data into insights that improve patient care, and they help save companies money, which is pretty powerful, right? Next slide. And then let me ask you another question. What do you think happens when the data going into these models are messy or unorganized or not in the right format? They're not going to be able to, the data would not be right. So the data will not be right. So that's where data engineers come into play. Data engineers are the people that build the pipelines from hospitals, clinics, pharmacies, and they make it all on one clear system so everyone can use. They make sure the data is reliable, high quality, and ready to use. So you can think of it like this. The data engineers are the people that lay down the pipes for the water to flow. And then the data scientists are the people that test the waters to test the waters and see how they can be better used. Okay, here is a graph that shows the outlook of data scientists in the US. As you see in 2020, it skyrocketed pretty far to 2025. This is because a data scientist, they are driven by AI and big data, which basically means they're turning this information into action, which a lot of companies find valuable. They usually have bachelor's degrees and master's degrees, and their salaries reach from 96K to 160K, but can reach to 129K to 176 in more senior positions. Yeah, next. And then there's this graph, which looks similar to the last. That's because just like the last, data engineers have become very valuable. Companies found them valuable. They are driven by AI and interoperability, which is basically making sure that the healthcare systems are able to communicate with each other, which is very valuable to companies. And usually someone in this field would have a computer science degree, an analytics degree, or an information science degree. Some salaries reach to 90K to 135K, and in more senior positions, they reach to 140. Next. And I know that we're all entering the stage where we're applying to internships, so I thought I would add a slide just to let you know that United Health offers summer programs in data analytics, HR, and more corporate roles. So there's a 10-week program, and they have hybrid positions and remote. And it's not like you're just running for coffee. You'll be actually having projects, and you'll be mentoring under higher officials. So now I'm going to be passing it off to Isabella, who's going to be going over the history of United Health Group.
Hi everyone. If you see me catching my breath now, you will know. Okay. So my slide, I'm going to be talking about the founding and history of United Healthcare, as well as the services that they provide and the performance growth throughout the years. So this is just a short timeline of United Healthcare, very brief. In 1977, United Healthcare was founded by a man named Richard Burke, which was the man that we saw on the previous slide. And it was incorporated in Minnesota, Edina. Before being United Healthcare, it was actually called MedCharter. And what this organization was in the beginning, it's an insurance company. But, as time passes by, in 1998, it was later turned into United Healthcare Group. And that's because they had a more diverse option of services that they provide. So other than insurance, they started providing services for patients, and Optum, which you can see here in 2002, became a new thing for them. Optum it's an organization that helps with getting prescriptions for the clients. So it basically helps with reducing the cost of medicines, and it's also very techy. So it's all about data analytics. It's kind of the beginning of data analytics with them. So I would just say that the difference between how they used it then and now is different, because back then it was more so about being able to just collect all the information. But now, like Vicky said, they're using AI more, and they're finding more solutions for different problems. So it's being more productive than it was back then. Back then it was more so for, if there's paperwork, you'd finish it faster, you'd get all the administrative done, and billing and scheduling just don't really everywhere. And then here in 2010, United Healthcare kept expanding. So they ended up having Medicare and Medicaid added, and go to the next one. These are some of the services that they provide. They have health insurance plan, health wellness programs, technology and tools, and pharmacy service through Optum RX. Basically, all of these services, starting with the first one, helps with getting you to find a coverage option, healthcare coverage option for you that fits you. Not a lot of people can afford healthcare, so they have different providers that is right for you and the necessity that you have. The health and wellness programs are for long-term illnesses, chronic diseases. It's very helpful for patients because it helps them keep on track with their illness. If a person can't pay for their illness, they're not going to be going to the doctors all the time, and they're going to get worse. At least with them, they have more options and more help. Technology and tools, as I said, that's where Optum comes in. And Optum RX is where they're mostly about prescriptions. Next. So their performance over the years mostly has been just on a huge incline. financial wise, just expanding and growing everywhere. They cover, the asset size covers like the whole US nationwide. And they also help internationally for many other people. They have the competitive advantage of being so big that they can choose whoever they want to work with. The growth drivers products such as Medicare, Medicaid, those are just like all the options that they have for you. So like other than insurance that you don't deal with them, there's still a bunch of other services that they kind of catch you in. And then integration of insurance services, this is just all about the insurance. Next slide. So now we're just gonna go discuss challenges, and I'm gonna hand it off to David, who's gonna cover this topic.
Thank you. So just to piggyback off what Isabella said, we chose United Healthcare because, like we said earlier, the health insurance industry is a $1.9 trillion industry, and United Health makes up about 30% of that market. So we thought it would be a good example to delve that direction. But with that being said, the industry is not without its fair share of challenges. Across our research, we're able to narrow it down to 4 main points. That's going to be growing healthcare costs, constantly changing regulations, rising out-of-pocket spending, which in turn leads to declining trust in health insurance amongst American consumers. So first, what's contributing to higher healthcare costs? First and foremost is new technology. The healthcare industry in the United States is at the cutting edge of innovation. There's always new technologies being applied to our procedures, new instruments being created for health professionals, which in turn is a good thing for us as consumers, but as an industry that is raising the cost of health insurance in the United States. Next is an aging population. The age group of 65 and older in the US has been growing rapidly. It's the fastest growing population in the US, and with that comes rising rates of chronic conditions, things like diabetes, heart disease, cancer. All of these things are on the rise, which is in turn causing costs to raise in the healthcare sector. On the right over here, I guess it'll be on the left. Right. On the right, you can see this graph that explains that shows the spending in the U.S. since 1970. The blue line is real dollars, and the green line is adjusted for inflation. But you can still see that as of 2020, in the late, it's risen to about $4.9 trillion, which that cost, unfortunately, gets passed along to the consumer. Next is constantly changing regulations. They're tightening regulation on privacy and security, stricter financial reporting guidelines, continuously changing antitrust laws, and ever-changing prescription drug regulations. Now again, this is a situation where these are good for the consumer, but this raises compliance costs for the company. They constantly have to hire compliance agents to make sure that they're following these regulations, that they're reporting on time, and that they're just following along with and making sure they comply with the U.S. regulations. And next is rising out-of-pocket spending. So in the United States, the average American is spending more money on out-of-pocket healthcare costs than they ever did. And healthcare costs in this instance, out-of-pocket costs, it doesn't mean the payments to the health insurer. This is all like money used for co-pays, prescriptions, hospital visits, things of that nature. The U.S. consumer is spending much more now than they did in the 1970s, obviously, not just on an inflation perspective, but just as actual dollar amount. We're just spending a lot more than we used to. The physician, hospital, and clinics costs have risen. Like we said, co-pays are on the rise, and prescription drug costs have risen, which all of this also feeds into our next slide or our next challenge, which is why trust in health insurance is declining. The rising rates of denied coverage kind of feels like everyone is paying more for less services. Disparities in access and outcomes for marginalized communities, unexpected charges that consumers assume would be covered. I believe the Commonwealth Fund estimated that about 48% of U.S. Consumers reported that they got a bill in the mail for a healthcare cost that they thought would be covered under their plan. And as of now, the KFF, which is a research organization based in the U.S., has reported that about 56% of consumers in the U.S. Don't believe that their health insurers are working in their best interest. And now I'm gonna pass the mic to Sonia, who's gonna be giving us trends in the healthcare industry as well as United Health.
Hi everyone. I believe some of you might be curious, so you just want to know what are the meaning of trends, right? Some of you? Okay. So trends, so they are simple, so just patterns, directions on which the industry or insurance company, so they use technology to move over time. So what I mean by that, so it's about like, for example, we are talking about the insurance, the healthcare and insurance. They use technology. They really use data technology to face the challenges, to get more opportunities, and to reach their goals. So now. Okay, so now.
Sorry, technical difficulties.
Okay. So this is the reason why we are presenting data analytics trends are shaping healthcare. So data analytics is innovating the way care is delivered, from predicting patient needs via industry transformation by emerging technologies. All insurers are using analytics, regulatory and consumer pressure, and a growing focus on strategic value. So, widening healthcare and insurance. So we do have several keys from data analytics on all trends in health insurance are using to get improved. So on the health insurance industry, they really focus on artificial intelligence and machine learning for predictive analytics. They have a clear purpose of communication, direct and indirect approach use. So they really focus as well on the healthcare fraud detection and risk analytics, ethical AI and equity insurance. Finally, the cybersecurity and data privacy monitoring. So, United Healthcare, it's one of the insurance company. So, like the one we are presenting today, who really focus on they really care about their customers, and this is the reason why they accept to adapt this innovation. Like they focus on they are using trends, and the trends they use it for their performance. So, like I said before, so United Healthcare it's adopting the emerging trends. So they do provide benefit changes and a plan design adjustment for their employees and their customers. And they provide as well. They have the predictive analytics and social determinants of health. What does mean? So this mean like they really use this as the way to determine the needs of their customers. Not only for health insurance, as well for social and environmental. The automation, quality, performance analytics, and member experience. As well, they were very good on transparency and oversight issues, customers' experience and operational efficiency, and the digital and operational efficiency gains, which is very important for them because they really need the feedback from their customers. So the key applications, it's about the performance. They have a team, so they have analytic teams and data scientists to improve their outcome. The United Healthcare applies data mining for fraud detection to its specialist investigation unit. So that means they have a special group to invest. To get investigation on not only on their plans they provide for the customers. Also, they really focus on whatever's going on as an issue. They care about that, and they have partnership with platforms like Innovalon, which provide quality data for Medicare Advantage and commercial plans. So United Healthcare as well analyze workforce health and plan design while protecting privacy. They also use predictive model to identify model members with social needs. Okay, so which means like the United Healthcare, to Optum and United Healthcare Group, so they really use AI, I may say the trends, because they consider this as a really helpful tools for them, not only to get new opportunities, to face challenges, also to reach their goals. And it is very helpful for them. Thank you.
So to wrap up, we know that the health insurance industry is a $1.9 trillion industry that's constantly growing. It illustrates both opportunities and challenges. There are a lot of opportunities for data science majors like us, like data scientists, data engineers. They're at the forefront of innovation with AI, analytics, fraud detection, digital care expansion. There are challenges like rising costs, regulation shifts, and declining trust. And finally, industry transformation offers strong career opportunities. We hope you're able to, view this information to kind of help you make a decision on where you want to take your career next. Thank you. Any questions?
I know some jobs in the insurance sector require applicants to have taken actuarial exams. So for the positions you mentioned for United, do you know if those are required? And for students who are looking to get a job in this field, what would you recommend, like technologies that we might pick up in order to improve our chances?
Okay, can you repeat the first part of the question? I got the second.
Yeah, the second part was
No, the first part, sorry.
yeah, sorry, the first part was with the jobs you mentioned in United, would they require actuarial exams?
Like making sure you understand it?
No, like if you want to become an actuary, you have to take exams. So in the insurance industry, some jobs, even data scientist jobs, require those exams to apply.
Okay, well, I'm not aware if they require that, but I know your second question, some things that could help you gain the job or some technologies they use consist of Python, R, SQL, the Tableau, normal stuff that you would see in your everyday data analytics class.
So what you're talking about is probably going to be more so senior level roles where you would need those type of certifications. Because when you go into the senior level roles, you are going to need additional certifications aside from just a bachelor's or a master's degree. Yes.
So to answer to the first question, I may say from some specific jobs, if you are looking for to be an agent with them, yes, you will have to study to get your license to be a specific agent, health, I may say insurance agent for them. But if you really need, if you're focused on getting data analytics job through them, so you don't need to get a license, You just need to be in the field, in the data insurance, the data science field, and then to get their jobs if you are qualified for them, so to get approved. So.
All right, thank you very much.
Anybody else? Well, thank you for having us.
One question.
Yes, that's right.
I know a lot of you are wondering if, or what were you gonna say?
Do you think healthcare, like or health insurance, like the cost will go down by any point in the future?
It's not really looking like it because, like I said, there's a lot of technologies being invented and things going into it that people are gonna want their money out of it. So the industry is projected to grow a lot by 2030, almost doubling, and that cost is not. It's not gonna be the consumers that are gonna be getting the cheaper part of it. We're definitely gonna be incurring more costs as time goes. Please.
Yes.
For like internships, are you guys aware of like where they're located, or do they have internships in Florida or neighboring states or anything?
Yes, they have them in multiple states. They have them in Florida as well. Pretty sure Fort Lauderdale or Hollywood. But yeah, that was your question, right, Danica?
I may add, like, if you go to each company, for example, United Healthcare and Molina, etc. So yes, if you contact them, so you say, okay, this is what you are looking for, and so you know the process already to follow, and then if they have it available, I believe they will.
And it's a, like I said, it's a 10-week summer program, so they should be having one coming up soon. The deadline's probably already passed, but you'll at least know next summer. Any other questions?
Bless you.
Oh, yes.
Well, I was just going to ask, do you have any, you mentioned the use of AI by like data engineers, data scientists.
Mm-hmm.
Do you have any, specific examples of AI being used? Or like how they're using it?
Will they use, I'm not sure the specific names of the AI companies, but they use them in order to make models. That's what I know, to make models.
I may say so. They have a different title between, and I think their meaning is different as well. It seems similar, but their responsibility they are different. So it's based on each company.
I know sometimes they use AI to be able to tell, like patient information to find early signs of the things that they might have. So.
Thank you.
Thank you. Thank you for having us.
Thank you.
Group 4, if you wouldn't mind giving your reviewers your email address. And then
Sorry, say that again?
Group 4, would you mind giving your peer reviewers your email addresses so that they know where to send their